Our panelists today are Janice Johnson-Dias. She's a professor of sociology at the John Jay College, and she's president of the Grassroots Community Foundation. Can you raise your hand? Okay. We also have Margaret Evans-Gale. She's the executive director of the American Association of Gifted Children at Duke, and she's also with the Research Network on Racial and Ethnic Inequality at Duke. Next, we have Rhonda Sharp. She's a professor of African and African American Studies at Duke, and she's also research director with the Research Network on Racial and Ethnic Inequality at Duke. We have Judy Malusa. She's a PhD candidate in economics at Howard University. We also have Amari Swinton. He's a professor of economics at Howard University. We have Wilhelmina Lay coming in. She's with the Joint Center for Political and Economic Studies. And last but definitely not least, we have Dr. Linda Green with the Prince George's Hospital Center. As I stated before, a more detailed bio is included in each of your folder, and presenters will go in the order in which I introduce them. Thank you.
Good afternoon, everyone. So I'm not going to use the PowerPoint, but I do have my notes in front of me. It is always kind of fun to talk after lunch, after we've gorged ourselves about health. I am going to be very brief, and my topic is to talk about health directions as we approach the next new wave of health policy and health research. And as I think about the notions of directions, I feel like there are three guiding questions that has to do with directions. Where are we? Where are we going? And in some cases, thinking about Ice Cube, are we there yet? And so my talk is really framed in that mind space. So where are we? So in America, it goes without saying that health and healthcare costs. And it is apropos that we'd be at an economic summit talking about health, especially given the economic challenges for families and for communities that health pose. And I'm sure it is clear to everyone that Black and brown communities and impoverished communities are those who are carrying the heavy economic burden as it relates to health challenges. So this is where we are. So we have about 15 million Americans 15% of Americans living in poverty. That's roughly about 42.6 million people. And many of those people, over 10%, are the working poor. Blacks and Hispanics, right, I rather say Latino, are much more likely to fall into this category, and certainly women are heading this list, particularly mothers. Now, the rates of poverty for children are particularly high, especially for those who are under 18. Almost a fifth of children under 18 are living in poverty, and adults 18 through 64, there's about 14% of them that are poor. And of those who are poor, more than a quarter of single mothers are without health insurance, compared to over 90% of the insured mothers in married couples. So we can imagine that America's most modal family type is a single mother with children being uninsured and living in poverty, what that means for your health. Right? So about 16.3% of Americans, roughly about 50 million, are without health insurance, at least in 2010. And we now have the passing of an act that's intended to adjust to this. Now, for Black mothers, about 10 million single moms in the United States, and 13% of the country is Black, and the substantial number of single mothers really are Black mothers. So what does this mean? What does poverty have to do with health? What does health and poverty have to do with economics? Well, we know that if you are poor and are in need of health insurance, you will be using several state programs like Medicaid. And Medicaid and CHIP provide care for about 40 million children a year. Children's access to dental care has increased, but not through this program. So I'm going to talk with you in a few minutes about Title IV of the Patient Protection and the Affordable Care Act, and what does that mean for us who may be interested in where do we go from here and where are we going. So the passing of the legislation means a lot of different things, and I'm sure that it's contested, and we're going to hear from one of our discussants about that. But particularly Title IV should be of interest to us. Title IV in the Act is called the Prevention of Chronic Disease and Improving Public Health. And in Title IV, we begin to see that the population of people that we really care about, right, which is not to say that we don't care about people who are not poor, but those who really garner and need most of our attention, those who are black, brown, poor, uninsured, this is where the action will be for them in this Title IV. So Title IV states that not later than March 23rd in 2011, the chairperson, in consultation with this council, must develop and make a public national prevention, health promotion, and public health strategy, and review and revise such strategy periodically. And it should target these areas of nutrition, exercise, smoking cessation, and the 5 leading disease killers. So in the United States, the top 5 leading killers are heart disease, cancer, chronic lower respiratory disease, stroke, and accidents. That's for all of the United States. For blacks, it is heart disease. They share number 1. Number 2 is cancer. Number 3 is different, stroke. Number 4, diabetes for blacks, which is number 7 for all of the US, and unintentional injuries, right? Now, unintentional injuries is a funny category. I can hear Sandy Darity saying, I didn't mean to shoot you. It was unintentional. So driving while black might be in that category. But to our particular focus, so we have in these 5 leading causes chronic illnesses that are preventable and are structured. And so we begin to say, what will happen? Where will we go from here in terms of the Patient Protection and Affordable Care Act? And what it clearly says is that given the charge of the council, we will be going to look at what actions need to take place in order to prevent these 5 leading deaths. And we need to pay greater attention to nutrition. Who had the fried chicken? Exercise. Who worked out this morning? That's a dramatically lower number. And stress. And we know now from the research around racial stress and allostatic load what this means for our society. So the question is, will there in fact be some action? And what and where do we go from here? So here are some of the things that I think that are important for us to think about. The largest concentration of blacks are in the South, right? 55%. We also have really large black populations in Mississippi, Louisiana, Georgia, Maryland, South Carolina, and Alabama. The leading cause of death in most of those places are related to things that are preventable, right? That the structural environment allows to occur. Right? So as we think about the direction of the Patient and Affordable Care Act, we begin to think, if we have to put our money on a particular set of action that would make it preventable, where should we put our money? Now, I run the Grassroots Community Foundation, and this community organization is targeted 10 cities where women and girls have the worst health outcomes. And we provide funding for community health programs and community health organizations such that they can do the work. And we provide them with technical assistance and support. My partner is Black Thought. You might know him from the band The Roots and The Jimmy Fallon Show. And what we have recognized is that in cities and in states like Mississippi, Louisiana, Georgia, Maryland, South Carolina, and Alabama, is that those at the lowest levels, the towns, the counties, don't often have the attention of these kind of broader rubric. I heard one speaker say today that we have to think, right, what is going to be the mass effect? But before one gets to the mass effect, one must think about the local micro processes, right, that are occurring in cities and towns that become the waves. So that tells us that 1, we know where we are. 2, the question, where do we want to go? It is not clear that we want to create a society where everyone is healthy. It is not clear that there is great benefit in that for the majority of people. But for some of us, particularly those of us who are at this meeting, it is most likely that we are interested in better health and well-being for these communities. What I suggest today is that as we look at preventable health, we begin to include something that is often missing. That we do have, slated in the bill, exercise, prevention, we do have diet, education, smoke cessation, etc. But one thing that is keenly missing is oral health. Nowhere in the policy there is one provision that begins to talk about it. Is there a significant amount of attention paid to oral health? Now, oral health is related to many of those cardiovascular diseases, particularly to heart disease, and the evidence says that that's growing. First, it was a nation evidence that suggested this relationship, but it is now growing to show that oral health. Now, we know that in our society, we know from some of the early research that oral health also affects whether or not you're going to be employed, much like obesity, that those who are overweight or obese are less likely to be hired if there is a job interview. Kids are not likely to be admitted to school if there's a face-to-face interview. We make assumptions about people, their competency, their intellect, if they're overweight or obese, right? Similarly, oral health presents that problem. Now we have the covariates of oral health and heart disease. So in our communities that are largely communities of women and children, the provisions that have been laid out ignore, except in the aspects of insurance. So the insurance information does talk about including oral health, but it is not broadly stated in the terms about preventative care. So as we think and we begin to focus on things, people like to think about obesity a lot. Our work thinks about obesity mostly because of the cosmology of it. We can see, right, that people are big. We make assumptions that bigness means unhealthy, right? We've come to, at least, hopefully, to understand that those are not necessarily truths. However, we can see teeth. But beyond teeth, we know that decay will live. And that decay is not just aesthetics, right? Whether or not you get the job or not get the job. It is also about the well-being of the person. But even if we were going to be, right, singularly focused on the aesthetics, if you are unemployed, if you did not get the job, right, then you now have a new levels of stressors. Those stressors translate to poor health. Those stressors translate to unemployment. Those stressors may translate to child abuse because of the stress. Anybody who has a kid knows, really? It's going to be challenging to talk to you when I just did not get the job, right? And we know that our communities are hyper-surveilled, not only by police, but also by child welfare. So we begin to think beyond what the policy has stated. So let me ask, at least with the final few minutes, to say, I've told you kind of where we are. We're poor, we're uninsured, we're mothers with children. Where we want to go is unclear. And so it's difficult to ask, are we there yet? But it is clear that even with this new law and this new policy, if we were to resurrect the ice cube question, are we there yet? The answer is clearly no. We are not there yet because even in the policy, particularly section 4103, that talks about Medicare coverage of annual wellness visits, we still don't have a lot of attention to the key issues that are going to affect our health. So we're not there, but I think it's important for us to remember that we still have the possibility of sharing the driver's seat, that we can still begin to enact policies both at the local level and the national level that can get us in a new direction. Thank you.
I am thrilled to be here on behalf of the Research Network and working with Dr. Darity. It has been a long ride since we started a project together on public education. So there is so much to talk about in public education that I couldn't possibly cover it in the kind of time that we have for this, because as each of you know, and most of you probably have experienced either as an individual or with your children, some major issue in public education. You've either been a product and have bad memories, maybe some good memories of a good teacher. But one of the things that I want to concentrate on, since we can't cover everything, is what I consider that we should be paying attention to. And certainly I would love for President Obama and the next generation of education reforms to move toward a more focus on teacher education. instead of trying to fix the children, let's fix all the problems that keep the children from achieving. Dr. Angel Harris, who many of you know, said, if we keep doing the same thing to raise the achievement gap, close the achievement gap, and raise the opportunity gap, it will take 100 years. And we don't have that kind of time because we're moving fast into a whole new world. So my focus today is on trying to think about a project that we could undertake on a national level that could really quickly reverse some of the trends in public education. And I believe the project that we've been working on for a decade in North Carolina, with recommendations from a commissioned report that Dr. Darity was commissioned to do for the State Board of Education in the year 1998, he focused on a number of recommendations that could help raise and close the gap that exists that keeps minority children and children of poverty out of honors and advanced placement courses and gifted programs. So he put in a lot of recommendations, out of which a nurturing program came about. And the focus on that was to say, let's develop a scholarly program for teachers and for kids. And by scholarly, I mean whatever we do, instead of defining it as an academic scholar, whatever we do for the future, we have to think about getting kids to grow up believing that they have to acquire knowledge for the rest of their lives, that focus on their interest and their work and solving problems. So this is a definition that Bright Idea operates under. So Bright Idea is, now I had pictures in here and they evidently are not showing up, but a picture showing that these children are Title I children in 30 schools that we studied for 5 years. And it's a nurturing program to meet the needs of raising the level of the curriculum quickly, immersing children in background knowledge. And you cannot do that unless you change the dispositions of the teachers to believe that every single child that enters their room has some great talent, some great hidden interest, and it's our job as teachers to find that interest and talent. I have been in this field 50 years, but my very first year of teaching was a Title I teacher in the western part of North Carolina, and my very first class was 12 8th grade African-American boys that could not read. And I quickly found out that these were smart kids. And so the rest of my teaching and administrative career centered from that first year of experience. So when we think about how do we do this, how do we really raise the level of quickly immersing children into high-level curriculum, then we have to focus on specifics. We have taken gifted intelligent behaviors and the gifted curriculum that's usually reserved for the top 3% in the country, and we start at kindergarten exposing children to it, under the assumption that Bright Idea, the name of our project, transcends all of these issues. While we have them during that part of the day, we do not use these excuses. And so I'm going to quickly just give you some highlights. If you want to know more, I left some brochures, and there are web links that you can get on and view classrooms. You can see a presentation by Dr. Darity, and the director of Exceptional Children in North Carolina that talk about the stats, and you can see children actually participating in the classroom. But the main thing that Bright Idea does, it changes teachers' dispositions to believe that all children can learn at the top levels of the curriculum. It helps them develop engaging curriculum to move away from basic skills and memorization. We even have proven that you can do great things with high-end exceptional children and those who have severe mental handicaps. It encourages innovation in the curriculum, and it builds partnerships among all of those that have a stake in the child's education. It is the best differentiated model I have seen in all my years of working in the field. It's a toolbox so that any teacher can take what they learn, and no matter where they go, they will be strengthened to teach at a better level. We believe that this training is at least equivalent to a college year of rigorous level of knowledge and best practices. It's interdisciplinary. It nurtures and engages every child around interests, learning styles, so that you're not leaving any children out in the classroom. And in order to do that, skipping over one here, there we go. This is at the heart of what we train teachers to do that they do not get when they are getting their training. And these ideas have been around about 20 years, but we start with kindergarten children. If you look at the left column, the concepts, universal concepts, are built into every curriculum unit that we train teachers to develop. These units can run 60 pages, and they're filled with best practices, strategies, so that every child in a class can do engaging in activities that get them excited about learning and quickly learning vast amounts of knowledge. It's problem and project-based. One of the units that we do is on Leonardo. The book itself is about a 7th grade reading level. We use this in 1st and 2nd grade to do Renaissance. They can learn art, music, science. They study all the standards from North Carolina's course of study. And then the culminating activity is a debate between Leonardo and Michelangelo. You could actually see this classroom experience in one of the links if you go online. And what's exciting about this is that the kids evaluate on rubrics the debate and decide who was the greatest creator of that time. And so it's about a 3-week unit that gets kids excited at a very young age about the future of learning for them. And by the way, the moderator could not speak English when he entered kindergarten, but he had a full year of Bright Idea, and he moderated this panel. These are some of the words that they learn quickly, and they know what they mean. They also do units on planning a whole community. They get involved in learning about everything in a community, how it develops, and then they actually build a community. They name it. They invite the mayor to come discuss what they found out. And if we think about what the data says, we know that 1 in 5 white children are destined to be put in higher level courses and to be identified as gifted. The chances for a Latino or a black child, and most times even children of poverty, it goes up to 1 in 20. We had significant changes in teachers in our research, but the most important change was that teachers finally were convinced that children were not necessarily born to be gifted, that they could acquire all kind of attributes and behaviors, and not to judge that where they were born, their zip code determined their course of action. And we also disproved a lot of the data that they were being told when they went through their experience in pre-service. But the most important data that came out of this, in every class, when we got to really looking at the level of identification for gifted programs, which is very high in North Carolina for the criteria to be identified, in the Bright Idea classes, we identified 3 to 1 children to go into gifted programs at the 3rd grade. So the data is clear. We still have schools operating that are showing this progress across the board. So when you think about it, the training that goes into getting teachers at that level is rigorous. They learn all the best practices. We bring the best trainers, and you can read some of these online and see more in depth. The impact on them is that they become curriculum designers, not just using textbooks to teach kids how to drill and practice every day. And the impact on students has been incredible. They learn thinking skills, they learn the gifted behaviors. 11 of those gifted behaviors take them a long way in developing resilience and giving them the confidence that they need to move up the line and take advanced courses. And number 1, suspension rates, behavior problems disappear. And now we have the big movement toward technology, where everywhere in the world, people can get access now to high-quality education online and learn knowledge immediately. So we have to deal with that and bring that training into the schools with teachers, so that as we think about education for the future, think about children being born today will live into the 22nd century if we get the health under control. So it's important that we put all of this together and that researchers out there develop new models and find ways to pay for it. These are the web links. They're in the brochure. You can always go to the Research Network at Duke, and we'll make sure that this presentation will be up. Thank you.
Good afternoon. Don't be alarmed by the title, but I will say my name is Rhonda Sharp, and I am a quantoid, but I will try to do my best to not beat you up with that too much. I'm choosing to talk about affirmative action and educational attainment because I think these are the two most important policies and issues that are facing the African American community. Now I know that there are some folks who will say, well, what about for-profit institutions? And my response to that is the work that I have done shows that if we look at for-profit, they are not enrolling what we would consider traditional age students. So those are 18 to 24-year-olds. So I don't necessarily see that as so much of an issue for our community as I'm thinking about educational attainment. I am also talking about affirmative action today because this is the 35th, this year is coming up on the 35th anniversary of the Bakke case. And it is also coming into the 11th year of the 25 years that Justice O'Connor said in Gratz and Grutter that, she was hoping that we would need affirmative action in 25 years. I don't think that she had anticipated that 6 of those 11 years into the 25 would have had the economic conditions that we are looking at. I'll also talk about affirmative action because I think it plays a huge role with respect to educational attainment and issues around participation. And notice I have a definition, and the definition isn't because I think that anyone in the room doesn't know what affirmative action is, but I have the definition up because quite often people want to use affirmative action and diversity to be interchangeable, and they're not. Affirmative action should be thought of as a tool to achieve diversity, but they are not interchangeable, whereas affirmative action is about providing opportunities to folks who have historically been disadvantaged. And I think that this is real important because initially when the thought about affirmative action was being introduced and implemented, it wasn't just folks of color, but it was also women. And if you look at the cases that are listed, with the exception of Bakke, all of the lead plaintiffs are women. Now, at first I thought, okay, maybe this is because it was alphabetical order in terms of all of the plaintiffs. Not at all the case. Lots of times the women's, their last names are not the first names that come into this. You'll also, if you take a note, you'll look at the locations, and a lot of them, Texas, California, Washington, Grutter and Bollinger, Grutter and Gratz is Ohio, and then Fisher is again back to Texas. If I think about the states, Texas, California, Washington in particular, these are, with the exception of Texas, these are also places that had initiatives on their ballots addressing issues of affirmative action. So what I did, which is not on a slide because I thought that might be too many numbers, was to go back and look at the educational attainment in those states by race. And one of the things that I noticed that was most interesting is between 1980, which is right after Bakke, to looking at the educational attainment on average for the 2000s, in particular degree and enrollment, I was finding that the share of whites in the public institutions in particular was dropping anywhere between 12 and 20%. So it might be, 76% in one year, it would be 50% by the time the 2000s, and I believe that's the case for California. And so I'm not suggesting that the changes caused the initiatives. I'm saying that it very well may have been a motivation for folks to be thinking about having these initiatives because, again, if you're thinking about a redistribution of opportunity and opening up access, I would imagine if you look around and it used to be 3 out of 4 of the folks look like you in the class, and now there's 1 of 2 of the folks who look like you, you may begin to think that perhaps we no longer need affirmative action, that all is well. I am also talking about affirmative action because I don't think that the courts are going to eliminate it. I do believe that what they're going to require folks to do is take more of a holistic approach. And what that essentially means is, they will look at everything from the quality of your high school. There will be a statement about how you contribute to diversity. It may be socioeconomics, although they know that if you use that as a factor alone, it won't replicate the type of diversity that you would get in student body had you used affirmative action, which in higher ed has usually meant that you get points for your race. And what I am concerned about that, and I think Bernie Anderson talked about that a little bit this morning, is the cost of that. And I'm not suggesting that institutions will shy away from it because of the cost, but I think there is both an economic cost and then there is sort of a psychological cost that happens both to the reviewer and to the student. And what I mean by that is if you believe, I don't, that we are in a post-racial society, asking students about their background and how they contribute to diversity will mean that a lot of the millennials in particular and the generation after them are going to have to understand the conditions in which they live in. They will have to understand the subtleties and the nuances of disadvantage and discrimination, and then they will have to be willing to write that or articulate it in an essay. And I think that there are a lot of students who are not willing. If you caught the CNN special about, who is black in America, the young lady who is Egyptian, was saying, look, I want to be black, but I'm checking the white box because I don't want there to be assumptions. So I think to ask folks to talk about how they contribute to diversity, some folks may not be willing to do because they may not fully understand how the committee is going to adjust that, view that. The next thing I'd like to talk about is educational attainment. And I think about these two in tandem because the access that you are afforded to go to higher ed greatly impacts your ability to get a degree on the other side. First, I'd like to talk to you about employment, and this is, I didn't mean employment, enrollment of first-time freshmen. If we think about the state of higher education and public, in particular public education, which feeds into higher education, we would expect that the enrollment shares of blacks would be going down. Now, sorry that this isn't that large, and hopefully you can see it. What you'll see is that the comparison is relative to white females, and I did that intentionally because they tend to be the lead plaintiffs. And what you'll see is this is white females, their share is going down. Here is black females whose share has gone from roughly about just a little bit more than 6% to about 8%. And here is black males, and their share has gone from about 5% to just a little bit over 6%, right? So when you hear people talking about the state of higher education for black males, I know for me and the work that I've done, it's always quite annoying because it lags behind black females, but this suggests a positive trend with respect to enrollment, in particular, first-time freshmen of black males, okay? So next, I'd like to talk about enrollment over the decades, and this is essentially the average percent of enrollment. So if you take a look, and what I wanted to do was, again, tie this back to affirmative action, where the bulk of the conversation and policies for affirmative actions are public institutions. So the question is generally, how many of us, or what percentage of that population do we actually make up? You can see in the 1990s, 8%, 2000, 9%. If you take a look at HBCUs, and that's what's, if you look at where blacks are enrolled, you can see that roughly 60% of blacks are enrolled in public institutions. Now, HBCUs are roughly 3% of all institutions of higher education, and they enroll roughly 19% here, and in 2016%. Now, I'm not going to have a long conversation about that because Omari and I had an intense conversation about this, like what is the cause? And it's not quite clear what are the causes, but what I can tell you based on our conversation is looking at the enrollment of HBCUs over the average enrollment over these years, that the average enrollment for HBCUs increased about 290%, I'm sorry, not percent, by 291 folks on average. Okay, so we looked at all the HBCUs, and that was the increase. Now, what we don't know is what's the increase in terms of shares of seats that were happening at both public and private institutions. So if you look at enrollment trends at HBCUs, and if you're wondering why I'm talking about HBCUs, it'll be very clear when I get to my conclusion. You'll see that the enrollment trends, again, show that looking at HBCUs, there has been a decrease in terms of undergraduate enrollment. And I look at that, and if you're alarmed, let me suggest don't be, and because here's the positive on that. And I hope that I can actually say this. This is going to be part of my work that's coming out in an encyclopedia article edited by Sandy Darity on HBCUs. Even with the decrease in enrollment, HBCUs still produce a lion's share of the folks who are going on, in particular, the folks who are going on to get doctorates in the folks who are going on to get doctorates. If we look at engineering, which HBCUs have been known to do a really good job with respect to the STEM fields, roughly 53% of all black doctorates in engineering attended an HBCU undergrad. And if you take a look at the physical science, it's about 58%, and that's looking at the decade 2000 to 2009, and those numbers are up from 40% in engineering and 52% for the physical science. So despite the decrease in the number, the share of enrollment for undergraduates, there's an increase in the number of folks in particular who are going on to get PhDs. And this is especially important as we think about the graying of the scientific workforce, right? And that's been a huge conversation, STEM. How do you broaden participation? HBCUs are doing a wonderful job in terms of providing access and producing the folks who are participating in the scientific workforce. I think I'll go past that and that. Okay, so I'll wrap up quickly. What I wanted to remind folks is, again, that diversity and affirmative action are not interchangeable. And then my last point, I think that now that John Wilson has gone on to be the president at Morehouse, that it is most important that the next person who is going to lead the HBC initiative at the White House be someone who is going to be a promoter of HBCUs in all that they do, and not necessarily have an environment where we are responding to why HBCUs are still needed and if they are still needed. I think that there is an excellent story to tell. And that ranges from everything in terms of, you look at the number of funding for research in the sciences that are awarded to HBCUs, which is something like less than 1%. And so if you can think about, there's a 1% investment that comes into HBCUs to educate Black scientists, and yet you're producing roughly 58% of the Black scientists who have PhDs. That's a story that's not being told. Right? And I think that that's an important story that needs to be told. And I also think that it is especially important in this environment as we're having conversations about affirmative action and there's conversation about broadening participation. I don't know how you can continue to have a situation where you're, as I tell my students, you're being reactive and not proactive about all that you do. I do believe that the role of HBCUs in the African American community as we move forward will become more and more important, and it is most important that HBCUs be mindful of their roles and again begin to tout that. And that's pretty much what I want to say, and that's sort of my thought in terms of bringing affirmative action together with HBCUs. Thank you.
Thank you. My name is Judy. I'm a graduate student here at Howard. I'm going to present a study that I've done on gentrification and racial discrimination in the housing market. So the motivation for this study is some of the contradictory findings that we have on the effects of gentrification in the housing market. And the premise of my study is that when you look at gentrification in isolation, it may not give you a clear picture of the direction or the effects that it may have on different households. But by relating it to other social or economic factors that are taking place in the housing market, then you're able to get a clearer direction that may be relevant for policy. So the hypothesis of the study relating gentrification and racial discrimination, literature on racial discrimination still shows suburban segregation remains persistent. So if you have racial discrimination taking place in the suburbs while you have gentrification in the inner cities, then this is going to lead to fewer housing options for minority groups. So the study, I use American Housing Survey data for the DC metropolitan area, and some of the research questions that I seek to answer look at the extent of discrimination, its variation across income groups, and the role of gentrification and spatial patterns on the discrimination. So the study is based on a search cost model, which I modify to incorporate the effect of gentrification on search costs. So what this model shows is that if you have aversion by white sellers to dealing with minorities or to dealing with blacks, then the long-run equilibrium is going to involve market segmentation with minority groups receiving housing at more inferior terms. So the assumption of the model is that you have buyers who know the distribution of housing, and they know their utility functions. So they have a choice to remain with the best house that they have so far, or to continue to search and increase their utility. So by introducing aversion into the model, aversion is introduced by alpha, which is equal to the probability of finding a seller who is averse to dealing with blacks, multiplied by the proportion of white sellers in the neighborhood. And then the proportion of white sellers is given as a function of amenities. And in that way, that introduces the process of gentrification. The justification for this is derived from literature that has seen an increase in amenities leads to reversals in spatial patterns. So you have an increase in amenities in the inner city that is going to reduce the low-income households. They'll be pushed out of the inner city as the high-income households move into the inner city. And then the other literature also shows the association between amenities and racial composition, with increase in percentage white increasing as amenities increase in the neighborhood. So when you introduce aversion into the model, the effect of that, the effect of introducing the alpha term is that a part of the density function is reduced to a value where the utility of the household is going to be equal to 0. So essentially, by having aversion in the market, that is going to reduce benefits of searching for housing for minority groups. And given that for the white buyer, the value of alpha is equal to 0, it therefore means that the implication of the model is that you're going to have price differentials, and the price differentials are going to be an increasing function of white composition, as well as an increasing function of the process of gentrification in the neighborhood. So to estimate the price differentials, I use a bid rent function. And just going through this a little quickly, the bid rent function assumes that housing units or households with similar demographic characteristics are going to have similar utility functions. So what I do is to stratify the households based on those 4 criteria, those 3 criteria, and then I also separate the white and the black households, and then run regressions for the black households to determine the coefficients for the black households. And then also I incorporate spatial regression analysis to separate spatial influences from racial preferences. So the coefficients that I derive from running the regressions on the black households, I then use those coefficients to determine the mean values. I use those coefficients on the mean values of the black strata and use the same coefficients on the mean values of the white strata, so that the divergence between the white bids, the actual white bids, and the hypothetical bids that the black households are paying is the measure of gentrification, or rather is the measure of racial discrimination. And then to estimate displacement, I use a logistic regression where the dependent variable is equal to 1 if a household remains in the same housing unit over a period of time. And then I introduce a ratio variable to see the extent of displacement for different racial groups. So some of the findings that I show for some of the strata, I see a significant gentrification variable, which is negative, meaning that gentrification does raise the bid rent in the neighborhood. And then I also have the racial composition variable. There's the percent white coefficient, and also there's the black neighborhood coefficient, which is positive. So it shows that as you have an increase in the white population in the neighborhood, that is going to raise the bid rent, while on the other hand, the black neighborhood variable, it's a dummy variable that is equal to 1 if you have 75% of the population in the neighborhood that is black. So that is positive, showing that the bid rent declines when the population goes beyond, the percent composition of blacks in the neighborhood goes beyond a certain level. And then the results also show presence of special autocorrelation predominantly in high income strata, and then they show increased displacements. This is shown in the results for the logistic regression. The black coefficient is negative, and what this means is that the probability of a black household, or rather the probability of a household moving out of this housing unit from one period of time to the next is higher if that household is black. And then we also have the negative gentrification coefficient, which also shows that when you have gentrification as opposed to a zone where you do not have gentrification, the probability of a household moving out of that housing unit is going to be higher. And then the results from the measure of racial discrimination, I see a variation such that the black households are made to pay more for housing units that are being occupied by the whites, so that the values for the hypothetical bids by blacks are higher than the actual mean white bids that are paid. So that shows that there's definitely racial discrimination with blacks paying more for housing. So some of the conclusions that I derive are the results show pure racial discrimination with blacks being made to pay more for housing identical to that of whites. And then the probability of racial discrimination is coming back to the inner city is increasing as you have the composition of race in the inner city being altered. And then you have displacement of blacks, which is disproportionately higher than that of non-blacks from the inner city. And then we also see market segmentation given the signs of the coefficients for the racial composition variables. So what these findings show us, they highlight the need for a revitalized urban housing affordability agenda as the primary means of addressing housing stress and combating the outcomes associated with gentrification and racial discrimination. Some of the specific responses that may be applied would include government finding more resources to finance construction or rehabilitate more affordable units and to support rent subsidy programs. And then also, in addition to that, we need regulatory measures that can be applied to encourage location of such units throughout urban areas so as to avoid the concentration of poverty that has been seen in public housing. And then other measures that these findings point towards is the development of mixed income communities which offer a variety of housing prices that provide housing choices for multiple income levels. And then thirdly, we have inclusionary zoning that can play a big role by mandating that a certain amount of housing must be reserved for low-income residents. And then other measures would also focus on increasing individual assets to reduce dependence on subsidized housing. And this would involve home ownership programs, job creation strategies, and also support for existing businesses, particularly in gentrifying areas, so that these businesses are able to weather the change that is taking place. And then finally, the policies could also involve increased participation by community organizations. Community should be able to play a bigger role in providing input into design and into the design and the redevelopment of the neighborhoods through probably allowing the community organizations to review development proposals to determine the displacement effects of some of the planned developments. Thank you.
While the PowerPoint's coming up, because I'm actually going to start off with discussing some of the conversation about education before I actually get into my presentation, which Rhonda kind of led me into perfectly, because any chance I have an opportunity to talk about the success that HBCUs have in producing graduates of any type, I try to use that. So I have somewhere I'm going to talk about the benefits of HBCUs, but I want to talk about education in a broader sense. And following from Margaret Gale's talk, a lot of the discussion on the reform of public education doesn't really focus on re-education of teachers. And it mainly focuses on student performance on tests and how's the best way we could test whether or not students are performing. It doesn't focus, as her policy talks about, as learning as a scholarly activity. And having learning as a scholarly activity will allow students to enjoy education more. If you look at some of the hypotheses that exist that state why students do not perform well, most of them say it's because students don't care. That's why they're not doing well, but almost all research shows that students want to perform well in school. And a lot of times they aren't driven to perform as well as they could because either the school lowers the curriculum, as we saw in Mississippi, where they lowered the standards so they could actually reach the levels that they needed instead of trying to raise the curriculum. And I think it's exciting that there's this work out there trying to change the way teachers interact with students at a younger age to sort of make teachers learn that students have the ability to perform, because students' belief affects students' performance greatly. If a student has a teacher who believes that they're not smart, the teacher will not push the student to do well. And so teachers' beliefs are one of the main reasons that we see low performance in schools, because teachers who are in low-income schools don't expect the students to do well, and since they don't expect the students to do well, the students don't try to do well, and this just leads to not great outcome. And so I find her work interesting, and she gave me her pamphlet. And I think it's something that, as a researcher, I should actually start looking into more, because I'm mainly a higher education researcher. But I think that issues on improving teacher education and the benefits of that are extremely important way of improving education outcomes in general. Going to Rhonda's presentation about education and affirmative action, one of the interesting things that we talked about, and she mentioned it during her presentation, is the decline to 16% of the share of African Americans who actually attend HBCUs. But HBCU enrollment has gone up. So what this means is other schools are more accepting of black students than they had previously been, because HBCUs historically served as the only location that would educate blacks. And so now a black student could go to any school essentially that they want to in the world, and seeing that even with options elsewhere, and I'm going to get to that in a second, black students still choose to go to HBCUs at a high rate, has to say something about historically black colleges and universities. And she put an emphasis on completions and attendance. I'm going to actually talk about completions, and I'm going to actually promote HBCUs. And this is something that I like to do any chance that I can get. And I oftentimes hear people talk about why HBCUs still needed. So in economics, we have this concept called dollar votes, in which people spend money on things that they actually want. And so if people don't want a product or service that's produced, then people won't spend money on it and it will go away. And so I'm just going to go through completion rates using from 1990 to 2010, 26,879 in 2010. And for Hispanics, Asian Pacifics, and other ethnicities as well, you see a substantial increase. And across all these numbers, there's an increase in dollar votes for the importance of HBCUs in conferring degrees. And when you look at associate's degrees and certificates, we see the same patterns. So blacks have, from 1990 to 2010, you see an increase of 2,783 to 3,588. For whites, you see a slight increase from 2,318 to 2,380. And for Hispanics, you see a large increase from 217 to 640 in 2010. And again, this demonstrates the importance of HBCUs by increasing the number of people that actually graduate from these institutions. So I'm going to take a slight step back from that before I finish, and noting that when you look at completions, it kind of doesn't give you the full picture because it ignores graduation rates, which is one of the crises that is also being felt in the American educational system. Graduation rates have been declining because the students who enter college are different from the students who entered college in the past. In the past, college was more for the best students, the best well-prepared students, and you had much higher graduation rates. And so colleges now are educating students who are less prepared for college, and they have to sort of change the way that they interact with their students because the student population is vastly different. You have a large increase in college attendance, but not a large increase in college graduation. And this is because the change in the new students who enter into colleges. And HBCUs have traditionally accepted the students who other institutions would not accept for whatever reason. More HBCUs tend to be open admission institutions and allow you to come as you are to allow students to get access to education that they previously wouldn't have. And so going back to the completion numbers, if you just count the total number across all years from 1990 to 2010, HBCUs have produced over 6,900 doctorates, 138,000 master's and first professional degrees, over 550 bachelor degrees, and over 119,000 associate degrees and certificates. Over a 20-year span, this is over 818,000 completions. And so if you want to know whether or not HBCUs are relevant, you could just look at the product that they produce in the form of their graduates to know that HBCUs are still relevant, that their relevance is increasing due to the nature of higher education now. Thank you very much.
What I'm going to do during my very brief comments is to look at what we have all gone through in the last several years as part of the subprime mortgage market meltdown and the Great Recession, and view this as a chance to sort of look back at some of the federal policies and why they were implemented, and look at our federal housing goal and see what all this that has happened recently means for what we might want to do moving forward. I'm going to sort of jump beyond the lunchtime discussion about what do we do to clean up the mess, because there's not a whole lot I can add to that discussion. But I do think that if we think about beyond the mess, moving forward, what we might want our our housing policy to be and to look like. In the 1930s, legislation was passed that established our national housing goal. Our national housing goal was defined as, decent, safe, and sanitary housing at an affordable price for all people. That meant renters and owners, rich and poor. It meant all people. But over the years since that goal was established, our pursuit of that goal has been largely by the way of non-defense discretionary programs. I'm using budget jargon here, but what that means is not everybody who qualifies or needs this decent, safe, and sanitary housing is going to get it. What it means is the people who are going to get it are the ones who are first in line when the dollars are being doled out, or the first ones on the waiting list for publicly assisted housing. So we established for ourselves in the 1930s a goal that says we're going to do something for all people, but we didn't say that everyone who needs it is going to actually get it. So what I'd like to do is to reframe what I think our policy problem is with housing and say a little bit about some ways that we might try to deal with that particular problem. The housing problem in the U.S. ever since the 1930s, or ever since we've thought about housing here, is linked to that word affordable. There's been a long-standing gap between household incomes and housing cost. And there's evidence that this gap has widened between 1960 and 2008, which is right before the subprime market collapsed, or right when it did collapse. And this applied to both renters and owners. In 1960, 12% of renters spent half or more of their income on housing. In 2008, 25% of renters spent half or more of their income on housing. The same applies to owners. In 1960, the ratio of median house price to income was 1.86. In 2008, that same ratio was 3.34, which was almost double. Now, if you accept my premise that our basic housing problem is the gap between household incomes and housing costs, then it's very simple. We can either tinker with the household incomes or we can tinker with the housing cost, and we can somehow bring them both more in line with each other. Now, taking it one step further, there are actually three basic types of methods that we can use. One, we can accept that both household incomes and housing costs are fixed or given, and then we can come up with some mechanisms that will bridge the gap. Over the last 50 years or so, those mechanisms have mainly been mortgages, and some of them have been of the very toxic kind. So I'll say that we have sort of been there and done that. So that's the one approach that I'm going to say we should just put off the table now as we think about moving into the post-subprime era. The second general approach is to assume that the cost of housing is fixed and do something on the income side to make income higher so that you can afford housing better. Usually that doesn't happen in the USA. When income is tinkered with, it's usually done through the tax code, and it's usually in the form of credits and things that wealthier people get more so than poor. So that leaves us with one basic method that we can use. We can accept that household income is fixed, but we can modify the cost of housing by modifying the cost of producing housing. And in the time that I have left, I'm going to say just a few things about ways that we might do that. Two of the ways that I think have shown themselves to have the most promise, one of them is Habitat for Humanity, and that approach, I'll say a little bit more about it. The other one is the Nehemiah Housing Program model, which emanated in New York City. Now, the Habitat approach, the program started in 1976, and they build what they call partnership housing. They have the people who need shelter working with volunteers to build simple, decent housing. The homes are built at no profit. Interest is not charged on loans because the loans are made to people when they buy the homes, but they don't pay interest. The building costs come from a fund that's called the Fund for Humanity, and it's a revolving fund. Money comes into the fund from the payments that the home purchasers make on their no-interest loans, and then the money just goes out again to build more housing. And Habitat housing is clearly low cost, and it does a different kind of job at bridging that problem between household incomes and housing cost. Nehemiah Housing, very, very briefly, started in New York City, mainly in the Brooklyn area. There was a consortium of more than 30 churches that has worked to help build housing largely in East New York and in Brooklyn. They're able to do this because the Department of Housing Preservation and Development in New York City helps them a lot. And the HPD, as it's called, for a recent Nehemiah project called Spring Creek Houses at Gateway Estates, they made it possible for there to be a subsidy of $46,000 for each of the new homes, along with, and I think this is perhaps more important than the individual household subsidies, a subsidy of $30 million to develop infrastructure, and they kept the land costs low because this particular development was built on a former landfill in East New York. So, what I'm recommending here is that we look at some of these models for bridging the gap between household income and housing costs and bringing them to scale, bringing them to the federal level. The Nehemiah program was briefly a federal program. No one in this room knows this unless they're a real housing nerd. It was a demonstration program between 1987 and 1989. Now, we're currently in 2013 in what I call a zero-sum environment, where if we're going to add money to do something different or something new, we have to say where it's going to come from. Well, I would be so bold as to say we should look at the mortgage interest tax deduction. And the reason I would be so bold is to say that it is estimated to cost the federal government $101 billion in fiscal year 2013, and this is tax revenue that the government says we will not collect, okay, because they're letting people write it off. So if we look at some of that money and shift it to programs such as Nehemiah, which was, as I said, briefly a federal program, or supporting more habitat-like programs at the federal level, bringing them to scale. I think when we look beyond home mortgages, which was the topic that I chose to speak on, and if we look beyond the current situation with a lot of foreclosures that are going to work themselves out as they're going to work themselves out, I think it would offer some ideas about how we can move forward in a way that could help narrow that gap between household incomes, housing costs, in a way that is more sustainable and what I would call community-friendly. Thank you.
I'm going to make a few comments about health care. I want to cover a few points about the Affordable Care Act, the importance of social determinants of disease, and the social movements that have led to improved health care in the past, and the reason that they're difficult to achieve. A couple of things about the Affordable Care Act. We all followed this with a great deal of enthusiasm, of course, when President Obama got engaged in the health care policy. And in going to early meetings, there was a discussion that there would be three parts to this health care plan. One would be improved access, one would be improved quality, and one would be bending the health care curve, cutting costs. And most of what I've heard since then has been cutting the health care costs. So I'm not so sure about the quality and access. I do, however, want to mention that there are a few people who will be excluded from this plan. One is the immigrant population, which is not only Hispanic, but also many people from West Africa and Asia. And these folks are not going to be covered under this plan. And the safety net that has traditionally treated both the uninsured and the immigrant populations will maybe become somewhat difficult to maintain because many people will be technically covered under the Affordable Health Care Plan, and many others will be clearly excluded, and rigidity of rules and policies within institutions may become much more difficult to manage for the providers, which I'm one of those. So when we try to take care of folks who are not covered under the Affordable Care Act, we may find it increasingly difficult to provide care for those folks, and the hospitals that serve those folks may take a significant hit. And places like Prince George's Hospital, where I work, could clearly continue to serve the uninsured under the Affordable Care Act, but will not be reimbursed by many of the other mechanisms that have happened in the past, and they may well become very much more in debt than they already are. So I think we have to look closely at how the Affordable Care Act will impact communities and hospitals on a neighborhood level. I also want to point out that the ideas about rationing of health care that go into the Affordable Care Act are kind of confusing. There's a lot of quality assessment, a lot of efforts to draw some lines that will be fairly useful for what really matters when we treat patients. what really is good. We know we have to treat diabetes and hypertension, and certain things are clear. Other things are a little less clear. But one of the big campaigns to cut healthcare costs has been coming out of Dartmouth, where the Dartmouth Atlas basically looks at Medicare and says that there's too much money being spent on this population. And when they look at the neighborhoods, and that it varies from area to area. When they talk about that, they are talking about areas which often had totally uninsured people who now finally got Medicare. If you're 64, you're waiting to get to be 65 so you can get some health care for many places in the country, including Prince George's County. So I think that the increased use of services in areas where previously they were not used is something that has to be carefully looked at, and the idea that some people are doing more for health care than others and spending more money really has to be carefully identified so that minority populations and the poor are not further penalized as Medicare gets attacked. Now, more important than all of the health care delivery that we could possibly give in our clinics and hospitals is the social determinants of disease. The social determinants of disease, or I really think of it as the capitalist determinants of disease, are really things that have to do with the broad topics that people have discussed today. There's housing, there's food, there's education. There are many things that factor into really what matters for health outcomes. One of the most interesting things that has been studied in public health lately is the idea that disparities in wealth predict for health outcomes. So that if you're in a country or a state where there are very rich and very poor people, and the extremes are high, the health outcomes are terrible. This is true throughout the South in the United States. It's true in many of the countries of Europe. Compared to us, we're much worse because of the extremes of wealth and poverty in this country than the outcomes that you see throughout the European countries and Scandinavia. So the disparity in wealth is something that I think a lot of public health people are really looking at, and they're trying to move towards equality. And a movie or a documentary that many of you may want to see if you haven't already seen it is called Unnatural Causes: Is Inequality Making Us Sick? Now, this documentary has been shown a lot in the last couple of years. It's put out by California Newsreel. And California Newsreel links health outcome data to inequality, and it links it also to some things that we don't think about in our clinics and hospitals much. And that's questions of power, control over your life, and stress, which I agree with 100%. That stress thing has become a much more important thing. I used to not think it was too important to my patients. They'd say, I'm stressed out. Now I really listen because I realize that the day-to-day stress of living under stigma, oppression, poverty, racism, that takes a tremendous toll on the body, and more we're understanding that it has the form of adrenaline surges that are constant at low levels and cortisol, and these things are destroying people's cardiovascular system, and it's making things much worse in many other diseases as well. It contributes to diabetes and hypertension, and it's a very serious matter to think about those types of things, which I never really include so much when I take a history from a patient. The people who have done some of the best work on this stress, by the way, is Kamara Jones, a doctor down at the CDC. Most of you probably are familiar with her work at some level. I would say she's not really welcome all that much in talking about these things by some of the politicians that are in Washington. And she had a little difficulty presenting some of her work at the public health meetings last year. And I think that we really have to take seriously the question of racism and how it impacts all of the parameters of health, and study her work and spread it around a bit. In the whole the social determinants of disease process, there's another doctor who's very well known, named Dr. Michael Marmot. And I would also encourage people to pay attention to his work. He's written the WHO pamphlet on solid facts, which lists 10 major factors that contribute to health outcomes, and includes all the things that we all know and talk about today. I want to mention a couple in particular. One is the idea of isolation and social isolation as it relates to poverty, which he defines as less than 50% of the mean income of people and a society. The poverty, the prisons, other things that exclude people, including stigma. I want to credit Howard University with having had 3 conferences in the last 3 years on stigma as it relates to HIV. excellent conferences and really starting to deal with the question of multifaceted stigmas that isolate people and keep them from getting treated. We know in treating HIV that if a patient has at least confided in one person, that their outcomes are better. Things like that, social cohesion, social support, community support, things that eliminate stigma are very important in healthcare outcomes, and we need to do a lot of work in this area. Your experience at work, I guess all of you are working except for right now. So when you're at work, do you have control over your conditions or not? This is one of the big issues in these studies that I'm talking about. If you have a high stress but low control ability to do your job, you are much more likely to have a worse health outcome. Taking on the social determinants of disease is a problem that requires a broad social movement. There are many of these things. Each one of them, housing, education, and so forth, require individual struggles under capitalism, but an effort to destroy the system of capitalism and create it with an egalitarian society would solve a lot of these problems much more quickly. We could develop a system that might actually work. The capitalists are not particularly interested in health care for the population as a whole. When they need a healthy worker, they will definitely put some health care into that. When they want to build the roads in the South, they will treat hookworm and anemia. When they want to, bottle beer in Central Africa, they'll decide whether or not to treat HIV or not. Coca-Cola chose not to treat it and just fire people. Heineken chose to treat it and have a stable workforce. These kinds of things that determine our future are really the way capitalism thinks about our health care. So it requires that we have a mass movement for equality, social justice, and these movements in the past have been very successful. They haven't quite gotten to the revolutionary stage, they haven't replaced capitalism, but they have often led to great advances in healthcare. The civil rights movement, the Vietnam War movement, and the women's movements of the 60s led to Medicare. They led to better healthcare in general, more visits. In 1984, I published a paper in the National Medical Association Journal with a couple of colleagues on the fact that these movements also benefited whites, that the things that were documented as coming out of the civil rights movement that meant better health care, more doctor visits, treatment of hypertension, Medicare, these things benefited white people a lot, and they came out of an anti-racist struggle. At that time, we talked about the anti-racist multiplier effect. This is a very important concept, I think, because when we fight racism, everyone in the society benefits. And so in healthcare, there's no exception. My last point is that when the makers of unnatural causes were asked about the disparities in wealth that tracked with health disparities, and they were asked, does this require a revolution? Well, they got nervous, those California newsreel folks, and they kind of tried to think of different things that they could do. They could fight for housing. They could fight for this. They could fight for that. But actually, they were wrong. I'm right. We should be fighting for revolution. We should be fighting for control of our society and not leaving it to the capitalists and the profit-making system, whether it's in healthcare or anything else. Thank you.
Thank you very much to all our presenters. They did a wonderful job, not only their presentation, but sticking to their time. So thank you again. We have a couple minutes for some questions, if anybody would like to ask any.
Hi, how are you doing this afternoon? My name is Dr. Adrienne Starks, and just a little bit about my background. I do cancer research at NCI, looking at how chronic stress influences cancer progression. In addition to that, I'm also on the executive team for Equity Matters, which is the Baltimore Place Matters team under the Joint Center for Political and Economic Studies. So much of what you said, especially with, and I'm going to use my agenda, Ms. Green, summing everything up, particularly for this section, was amazing. It was kind of an amen experience. I had two questions, though, one particularly for Ms. Diaz and Ms. Gale, because you were talking about programs or organizations in which people can, I guess more so be active in participating in. And my question is, how, for the grassroots organization, How broad spread is that beyond the areas that you're looking at within the South? And how can people become involved in that and maybe use that within their community? And also with Ms. Gale, when I was a kid, I was in the gifted and talented program as well, but it left probably in 3rd or 4th grade. And I was wondering kind of what it's the environment within education beyond, the environment of the gifted and talented program right now that you see.
One of the things you could do is read the New York Times article that was published January 12th about a situation in New York with the way they segregate black children and minority children from white children within gifted programs. And then the gifted identified program is even classified by most people as being general education. So I tell you to read that, in that it just points out a system in America that has such misinformation and such discrimination and resegregation of children of color and also from poverty levels. But on a national scale, we still have not moved the numbers to increase the numbers of children from poverty and minorities to get in advanced placement, honors, and gifted programs. And it's rampant throughout the country, so the data hadn't moved in all these years. But there are people that do get in those programs, but it's not representative of the populations. And so I think it's important to think about what we need to do in policy to move that number so that all children get exposed to good curriculum. That's what's missing, and teachers are not trained to teach. If they have 20 students in a class, in many of our districts, there are 20 different cultures and representation from different languages. And so teachers aren't prepared to teach like that. So they have to be trained to be able to set their classroom up differently to teach. So the more we can get the word out and to work on the disparities in the education environment, and the national, even Obama's administration with Race to the Top, has not really moved the peg in spite of all the money. And the Common Core standards are going to just put more emphasis on basic skills and not move the peg either. So I would suggest we all get involved in trying to make new policies in the reform effort arena. And that's really tied to the economy also.
Thank you.
So thank you for asking that question about grassroots, because usually, one doesn't get a free PR moment. So it's easy to get involved with grassroots in the sense that we have a website. It's grass-rootsfoundation.org, at least at that level, and opportunities to volunteer. So we currently have a 10-city initiative, and what we've done is we organize the data for all large MSAs in the United States by looking at the nexus of mental, physical, sexual health, and poverty. So we created a coefficient for each of these large areas in order to organize the entire United States. And what we did was we took the top 9 as our first set of initiatives, and we have one strategic site in Greensboro, North Carolina. And what that then allows us to do is we go, sometimes we're invited to these cities, but we started with the city of Philadelphia because we had such assets there and Black thoughts from there, and that's where I got my PhD. And we have been working with the organizations there, but any city can actually adopt the model that we're seeing positive outcomes around. So in each of our programs are either through community-based organizations or community programs embedded in schools. And we've been primarily in schools because we understand that that's the one place in the United States that you're mandated to be a part of that structure. So even if you're homeschooled, right, at some point you have to interface with the educational system. And so it becomes really a place where we need to pay greater attention if we're interested in the health and well-being of our society. So we have an after-school-based programs, we have 5 after-school-based programs in these 3 cities. So we're currently in Philadelphia, Newark, and in Greensboro. And those after-school programs are actually designed by the people in those communities. So they all have a different name and they all have a different component, but they respond to the local culture. So one of the things that is disconcerting, and generally it's kind of an undercurrent that runs in much of the theme that I've heard today, is thinking so largely about the fact that we need really big effects and missing what is happening in these communities. Local context shapes our well-being. Right? So, for example, we have cities that are not thinking about health policies. So dog leash laws is a health policy issue. Why? Because we encourage people to actually be outside using their neighborhoods. So there are many policies that exist that are not explicitly health policies, but have unintended health impacts. So what does that mean for the question you ask? I want to be able to give you something concrete to say. So if you're in a city, or you're in a town, or even a neighborhood, one of the things that's important is to find other like-minded stakeholders who says something ought to be done, but it cannot end there alone. We combine not only hip-hop, because clearly hip-hop is the greatest medium for spreading messages, good or and we combine that with the importance to use science. So one of the things that Margaret began with, which I think is important to reiterate here, is that there must be a systematic approach. One must begin to measure, right? Set goals, but measure how you get there. That has been the biggest challenge on the ground for us. So in each of these sites, we collect data systematically, not only pre-test and post-test, but organizational process data in order to understand if we're in fact moving the dial. But it is in these local spaces that you begin to form the aggregate information that can then lead us to say we are actually affecting or impacting or positively affecting. So I would find these stakeholders, make sure that they're educated. Training is a crucial part around the significance of research, and then develop a program practice and be willing to work through the kind of challenges that comes with it. And then it's quite possible. Also, you could just call me, and I'll be happy to
do.
Thank you.
I have a question for Dr. Sharp and Dr. Swinton, which is a request, actually, that you comment on the implications of the growth in enrollment on the part of blacks in for-profit colleges and universities, because that's an area in which there has been a significant increase in enrollment. And would you also please comment on what the implications are for people who actually complete degrees from those institutions in terms of the opportunities that they'll face in the labor market? Thank you.
So I'll go first. One of the things that it really depends on the field, the effectiveness of for-profit institution, because for most of them there's a stigma attached to actually attending a for-profit institution. And so it really depends on the field and how successful that institution is at actually having the student complete. What research shows is that people aren't more likely to complete at a for-profit institution as they are at a non-profit institution, but they're more costly, so they're more likely to run up a higher debt. And so depending on if the person finishes, if they don't finish at a for-profit, those credits are not likely to transfer to any other institution, so they basically drop money down the hole and have nothing to show for them that they could take with them. If they finish, depending on the field, there might be a stigma attached to the degree that they earn, which would make the value of the degree less than if it was at a traditional type school.
Okay, so I'm going to take a slightly different approach to MRAs and suggest that I'm not sure that people really know the full effect of what's happening. And the work that I've done looking at for-profit institutions, their degrees are very narrow. So they generally are producing degrees in education and in business, where if you're looking at, and again, I should be saying that I'm thinking about the institutions that would be competing with Howard's and your more four-year colleges and not your ITTs, your DeVries, and the technical institutions. I'm not talking about them. I'm talking about places like Phoenix, University of Phoenix. I want to say Southeastern Nova's, the school in Florida, because I'm going to get their name wrong. They're very narrow in terms of the degrees that they produce. Again, the work that I have done has looked at black women, and what we know is it's not traditional age. So there's this notion by a psychologist whose name is escaping me, where she talks about it being the third shift. What I think is happening with a lot of the for-profit institutions are the folks who are not finishing at your traditional four-year institutions, who go get jobs for a variety of reasons, then hit that ceiling and recognize that they need a degree. And so for many of them, I don't think it's the same type of signaling that you would think about folks from a traditional four-year college. It is about completing that degree to compete for a raise or a promotion, not necessarily entry into the workplace. Now, having said that, I do think that as Congress is pushing us to really think about workforce preparedness, the research around for-profits is going to have to increase, but it may also come at a cost, because what it means is whatever you're finding out about for-profits is going to be in comparison to your traditional four-year. So while people may think that they're putting for-profits on the hot seat, there could be negative consequences for traditional four-year institutions in that they're going to have to do a better job. So if I extend that, I mean, that is one of my concerns as they've talked about workforce preparedness, and as Omari has talked about with respect to debt and completion rates. I know this is, everyone in this room pretty much knows this. I mean, this is also the conversation that if you're talking about HBCUs, low completion rates and high default rates, right? So I have been concerned that as they're pushing that workforce preparedness, that it could have consequences for HBCUs. So I'm just saying, as the research is moving forward, and it's going to have to move forward, because there is a population that are utilizing. Now, I would say this too. We need to be very mindful when you hear the University of Phoenix say things like 65% of their folks are folks of color, to again be mindful, they're not our traditional age college students. Okay, so don't hear that and think, oh my goodness, my baby is at this school, because it's not your, well, it might be your baby, but it ain't your baby that might be at that school. So please be mindful of that as you hear them talking about the diversity of their institutions.
No doubt. Good afternoon. My question is, I guess, to the two panelists that touched on healthcare. And I have some group of folks during the campaign created a super PAC with members of Kappa Alpha Psi and Mega Psi Phi, and we kind of organized folks in battleground states to support the president. And after now that he's won, we were looking at things that were important to his legacy, and we thought Obamacare was one of the big initiatives that he forever will be known for, even after his presidency. And we were looking at ways that we could do more to help. It seems like such a huge process. So I wanted to see if the panelists could help. And it's like a two-part to one question. How can we use Obamacare to help more people? And how can we benefit from the monies that will be spent on a new process? So I say it twofold, meaning that how do we make sure that we get more disadvantaged folks, or folks who are just not aware, to know what Obamacare is, to understand the exchange process, and to become and maximize the benefit from it. One. Two, most, and I'm an insurance broker by profession too, but most folks in insurance businesses are Republicans, very conservative, and fought the whole process and don't want us to get closer to universal health care. They want to keep a big, person in between, taking money from folks and not spending on making people better. But with so much of this process being unveiling between now and October and in 2014, it's going to be a lot of money being spent, and they've already spent a lot of money, I mean millions and billions of dollars, and we'd rather not have folks who really don't have the interests of our people making the money. We want to make the money too, unapologetically. So we want to be able to help as many people with this new process, and want to figure out how we can get more folks engaged in the process and make some of the monies that are going to be spent.
Okay. I'm not sure if I completely understand the question, but I do know that there's a lot of variability in the way people are trying to set up to provide health care under the Affordable Care Act. One of the things that I would really like to see, and I don't know if you're involved in this or not, is the idea of patient-centered medical homes was a big idea. And there is some money for that. O'Malley is just putting money into Capitol Heights as an area that needs specific help in developing primary care, and he's right about that. It's the #1 AIDS zip code in the county, and we definitely have tremendous poverty there. So if they create a number of primary patient-centered medical homes that have a broad range of services, like she was saying, where you look at nutrition and things like that, a lot of people should be engaged now, or they even already, in trying to be a part of that kind of process. Because that's more than just, it could be more than just a few people providing, a few doctors seeing patients. It could be much more focused on some of these issues like nutrition and education and community support. And so if in some neighborhoods there will be some money put. Is that kind of what you're trying to get at?
I think on a large scale, let me give you an example just real quick. So one of the things they created was navigators. Are y'all familiar with navigators?
Yeah, well, like Maryland is was working pretty hard to try to implement this plan. O'Malley really does want to carry it out. So there's lots of large-scale meetings that go on there.
No, I got you. Well,
But I'm not sure that there's too much that is happening except to work out the exchanges, which are mainly going to deal with the insurance companies, as I see it. I mean, it's not really, there's no public option, there's no single payer for sure. Did you want to?
Yeah, so I'm going to make my answer within 30 seconds. So to the first question, what can you do to support PACA? The first thing is to recognize that it's flawed. The second is to get the stakeholders and the super PACers to actually read, because the truth about the bill is in the details. And once you have an understanding of those details, they can be translated through multiple ways to the people who will use it. How to teach people to benefit from it is going to be in what are their rights underneath it. The good thing about the bill is that it has multiple provisions for revision, right? And so each of the local municipalities and policymakers have within their in their tradition, the possibility of revising what does not work for their constituencies. So once people read it and know what it is, then they can act and use it to the best of their ability.
I mean, in Maryland, we have made some effort to include more inclusive language into some of the exchanges and some of the ways people are going to be educated. But I agree with you in general that the population still doesn't really understand how they're going to make this thing work. And most of my patients are waiting until January 2014 to find out what's going to happen. And they're not going to be doing stuff leading up to it unless we're very, very aggressive.
Most of your comments, very interesting comments on HBCUs, seem to be applicable to state-supported HBCUs. I would be interested to hear your views on the plight of the small, private HBCUs, most of those affiliated with the United Negro College Fund. Most of those institutions are facing declining or slowly growing enrollment, and colleges and universities are tuition-driven. They're facing increasing operating costs, high levels of deferred maintenance of their buildings. What else is it? They also are facing sharply declining corporate and foundation support. Those institutions are facing also increasing stringently high accreditation standards being imposed by the Southern Association of Colleges and Schools. This is a spate of issues. Several of them have already lost their accreditation. Morris Brown University, Barbara Scotia in North Carolina, Shaw University has been under the hammer. There's a question about St. Aug. You can go right down the list of these institutions, a number of them in North Carolina, but also in other places. what is your view on the future of those smaller private HBCUs, some of them church-related? And what policies do you think the federal government should pursue in order to save those institutions if, in your view, you believe they are worthy of being saved for the future of education for black people in this country?
Okay, so let me start by saying nothing in my comments distinguish public from private in terms of talking about production. So it's harder for me to answer that. I don't look at them as I'm looking at degree production separately, right? So I look at HBCUs in totality. I do not separate them out in the work that I do to talk about publics and privates. Now, having said that, that is sort of the intense conversation that Omari and I have had. Most HBCUs are tuition driven. Right, and so if you look, and it's fortunate that I actually have another talk up, when you think about the economy, right, as the economy changes and everything becomes tighter, all institutions across the board are hit. The impact for HBCUs, which are tuition driven, which is what most HBCUs are running anywhere between probably 60 to 70% being tuition of their revenue for operation coming from tuition. So if you don't have butts in the seats, then you can't hold your door. You don't open your doors. Now, I'm coming from Bennett, right? So we were on fiscal probation for a couple years. When we don't have 630 some odd students, or I should say when they don't, it's challenging in terms of operations. I am going to decline in terms of making any federal recommendations because I don't look at them separately. But I do think that the question that you're asking is one of those when I'm saying about promoting and really thinking about HBCUs so that you're not in the reactive mode is the type of research that needs to be done to actually take a look and begin to ask the question, is there anything specific about HBCUs that are private and affiliation with the church that is different from predominantly white institutions that may have the same affiliation with, in particular, the Methodist Church. I do believe the issues around SACs are ones that I've always wondered about, and it's not just, it is those high standards. It's everything from whether or not I'm turning in my transcripts for my institutions when I'm at this place, and I don't turn in my transcript when I'm at this place, right? All of those things I think definitely matter, but I'm not in a position to make recommendations because it's not where my research goes. But I do think that your questions are valid questions for researchers who do work on HBCUs to get at that, because I do think that we are at a point where if the economy does not change, what's going to be happening for HBCUs in terms of fiscal stability. And I've had some conversations with folks at SACs. You know, SACs treat your faculty bad, have maybe some issues around curriculum. They might look at you, but that fiscal instability, they take seriously, right? And so with the fiscal instability, I think HBCUs become more at risk, but it's not a question that I can answer for you.
Thank you. This ends this session. Just thank you to all our presenters. We do have another session after this, so please don't leave. Stick around.